Hello and welcome to McLaren Port Huron Today's Health Program. My name is Kelly DiNardo. I'm your host today, and we're going to be talking about serious conditions that affect the colon. Joining us today is a board-certified general surgeon, Dr. Karen McFarlane. Dr. McFarlane, thank you for speaking with us today.
Thank you for allowing me to be here today.
So as we start, I think it might be a good place just to maybe do an overview of the anatomy of the colon.
Absolutely. Let's look at an image. So the colon is actually divided into four main parts. We have the appendix, which is just a very tail end. This often causes what we call appendicitis for surgeons. Wakes us up at 2 o'clock in the morning. That's beside the point. We have the ascending colon. It swoops around to the transverse colon. You have the descending colon, the sigmoid colon, and the rectum. I often describe it as the exaggerated question mark if you look at that.
Okay. So what are some of the more serious conditions that affect the colon?
There are several. The common ones that we come across includes diverticulitis. We come across cancer. There can also be bowel blockages. We also see chances where patients can develop bleeding from diverticulosis, as well as what we call inflammatory disorders, which is Crohn's versus ulcerative colitis.
So let's start with Crohn's. So what exactly is Crohn's disease?
Crohn's disease is defined as an inflammatory disorder or an inflammation of the body. Primarily, the immune system really doesn't know how to interact with your bowels, and it's usually a disease that affects anywhere from the mouth to the rectum. We often see this happen it targets people usually between the age of 20 and 40 years old.
Do we know what causes Crohn's disease?
Actually, we still are trying to identify that information. We find that certain age of people, which is 20 to 40, we notice that if there is a genetic predisposition, so if it runs in your family, you also run a risk of that happening to you as well. People of Jewish descent, etc., including being in more European heritage.
So what are the symptoms of Crohn's?
Actually, symptoms can be mask or mimic that of even colitis. Patients will come in with what we call chronic abdominal pain. Oftentimes, it can also be anemic because it's a chronic condition. They'll have a low appetite, and they'll also have troubles with eating. But the primary thing with Crohn's is something that affects anywhere from, again, mouth to rectum.
And so you had talked a little bit about like hereditary, but are there other like lifestyle risks that put people at risk for Crohn's disease?
Actually, there is. Part of that is what we call like a high-fat diet, a processed diet can put people at risk. And also there's one bad habit that tends to make its way, tobacco use as well, put you at risk.
That's very interesting. You wouldn't think that would, affect your digestive system too.
Well, the thing with tobacco, it's inflammation. Okay. So Crohn's is also what we call an inflammatory disease.
Can Crohn's be cured, or how would you go about treating someone that has Crohn's disease?
Unfortunately, Crohn's is not curable. It is something that we can put into remission. So you have what we call acute disorders, meaning you have an acute flare-up or an attack, but usually in terms of treatment, we call it medications to suppress the symptoms.
So does Crohn's come on quickly, or what kind of what would make someone maybe see their doctor about kind of symptoms that they are having?
So again, if they're coming with symptoms with the abdominal pain, diarrhea, they can have blood in their stools, and with weight loss, it's a prolonged situation. It smolders for weeks and then months, you're not really improving, then your doctor really has to start thinking about more than just what it could be. And if you fall into the family history as well as the age factor, then there are other things it can do to figure out, is it really Crohn's?
So how would it be treated?
Treatment is primarily look for medications. And medications, we call those immune modulators, which is something that helps to calm your immune system such that it doesn't react or attack your intestines or your bowels.
Okay. Does anyone ever need surgery for Crohn's disease?
Usually that's the last resort. So for example, what we call the complication of Crohn's includes if you have blood in your stools and develop bowel blockages. You can also develop what we call fistulas between intestine. And last but not least, infection like an abscess. At that point, then you can either go and drain an abscess or even what we call remove portions of your intestine.
And is that a major open surgery, or how? What?
Thank God for technology today. In the past, it would involve making an incision just below your rib cage, right above your pelvis. But now we have other approaches. We call it laparoscopic approaches. We can also do what we call robotic techniques now.
And so that's obviously less invasive then?
Absolutely less invasive. So before, with open surgery, patients with open abdominal surgery would be in the hospital maybe 7 to 10 days. Now it's something maybe overnight.
Wow, that's great. And then less complications too. And
Absolutely. I mean, it's very hard to see those scars, and some people do believe in that cosmetic factor.
And does the laparoscopic usually have like less bleeding or faster recovery?
Definitely less bleeding, less infection, less pain, overall optimal recovery. You're talking about, instead of being in a hospital for up to 2 weeks, you're back home in the confines of in your bed and within a day or two.
So just to kind of recap, does Crohn's really affect someone at a certain age in their life, or if someone's watching this program and they're thinking, wow, I might have some of these symptoms, is there anything else?
So ideally, we would hope that if you have a smoldering, meaning a slow, I've always had this crampy abdominal pain, that you don't wait 2 decades for it. By that time, 40 is already here. But usually we see it for people in their 20s, upwards to their 40s. And what will help is doing something even like a colonoscopy. Okay. The other, to also help with the diagnosis, is there's a lot of blood work that's available nowadays.
Well, so, and usually colonoscopy is recommended starting about age 50 that people have?
Usually age 50, usually age 50. And what makes Crohn's a very specific disease is that, again, it affects anywhere, not just the colon, but anywhere from your mouth to your stomach to your intestine as well.
So it could be maybe a little bit harder to
A little bit
pinpoint.
harder, but thank God for blood tests, because that helps to figure it out too.
That's really interesting. This is really great information about a very serious condition that people might not think is.
Absolutely. And if anyone is in doubt or is concerned, I would just strongly recommend that they follow up with their doctor and say, you know what, I understand Crohn's might run in my family, my symptoms. I'm concerned. There's nothing wrong with a simple blood test.
Dr. McFarlane, this has been really great information. Thank you for sharing this with us. We need to take a little break, so please stay with us and we'll be back in just a moment.